Good afternoon, I'm Dr. Fritz.
Hi, Dr. Fritz.
Hey, it's nice to meet you. Alright, well, what seems to be the problem?
Well, I've been experiencing some gaps in memory, and I feel confused a lot lately. And my friend says I've been spacing out a lot.
Okay, well, when did you first realize that this was happening, or when did you first experience this?
I noticed this happened about a few weeks ago, though I had just assumed she was spacing out.
Okay, well, is there any history of seizures in your family, anything like that?
No, I don't think so.
Did you experience any head trauma lately?
Actually, I was in a car accident about a month ago.
Okay, well, from what you've seen, how long do these episodes typically last?
I'd say about 30 seconds.
And what do they typically look like?
Well, she'll suddenly stop whatever she's doing and blank out, completely unresponsive. It'll take a few minutes, but eventually she'll come to.
Okay. It sounds like you may be experiencing something called discognitive seizures due to head trauma. But we'll have to run some tests to be sure. First, we'll run an EEG to measure the electrical activity in your brain. Then we may run a neurological examination, and we'll also draw some blood. Until we know more, you should probably avoid swimming or operating heavy machinery.
Okay.
Thank you so much.
Hello.
Hi, Dr. Fritz.
Hi, it's good to see you again.
So, did you find anything?
We reviewed the results of your test,
Uh-huh.
and based on your neural activity during seizures, we believe you have focal discognitive epilepsy.
Yeah, what does that even mean?
Focal discognitive epilepsy involves the occurrence of seizures brought on by abnormal brain activity in localized areas of the brain.
Okay.
So basically, seizures may cause you to lose consciousness and maybe appear to stare off into space, much like what your friend was describing, and also become unresponsive until the seizures have ceased.
So, what are my options as far as treatment?
As far as treatment, there are several options, and the one that I'm going to recommend for you is what's called an anti-epileptic medication. What I'm going to do now is I'm going to refer you to a neurologist, and he can answer some more of your questions, okay?
Thank you, doctor.
Cool. Thank you.
While epilepsy is most commonly diagnosed in children or adults over 60, it can develop at any age. The cause of the disorder can sometimes be traced to a head injury or medical issue, such as meningitis or encephalitis, or any of the other reasons shown above. However, in about half of all cases, there is no identifiable cause. Because epilepsy is caused by abnormal activity in brain cells, seizures can affect any process your brain coordinates, which is why our patients experience confusion, loss of awareness, and staring off into space. Symptoms vary depending on the type of seizure, but in most cases, symptoms will be similar for each episode. Symptoms can be classified as either focal, which is in one hemisphere, or generalized, in both hemispheres, based on how the abnormal brain activity begins. You must have 3 or more seizures in a consistent manner to properly be diagnosed with epilepsy. The doctor will also perform tests like the neurological examination, blood tests, and EEGs. Neurological examination will test your behavior, motor abilities, and mental function to determine what type of epilepsy you may have, while blood tests are used to see if there's genetic basis or infection. EEGs are used to get an actual better understanding of the electrical activity of your brain. Patients with epilepsy tend to have abnormal brain patterns even during non-seizure episodes. GABA is crucial for inhibition in the brain. If GABA receptors become blocked, neurons will be able to fire much more frequently. This rapid overfiring of neurons are the basis of a seizure. Where exactly this happens in the brain determines the overall effect of the seizure itself. The overexpression of excitatory neurotransmitters can also have the opposite effect and will also lead to seizures and eventually epilepsy. Repeated seizures, especially in one particular portion of the brain, can cause epileptogenesis, which is the formation of epilepsy. Short random seizures will, however, cause no permanent damage. The issue lies in repeated uncontrollable brain spikes in a particular region of the brain. The most common treatment for epilepsy is anti-epileptic medication, and this has been seen to decrease symptoms in the vast majority of patients. Similar to antidepressants, due to the differing chemistry of everyone's brain, it may take a few trial and error processes to find the proper dosage and drug that works for a patient. In patients where anti-epileptic medication does not work, they have the options of vagus nerve stimulation or deep brain stimulation. Both of these involve an electrode or pacemaker-like device placed into the body or brain, either near the area of seizure or on the vagus nerve itself. These are used to slow or stop the release of neurotransmitters and hopefully bring down seizures. Once patients have been diagnosed with epilepsy, they are more prone to seizures and have to cut down on risk behavior. This means that as a college student with epilepsy, our patient will need to make sure that she is still exercising, eating properly, and not pulling all-nighters, because this will decrease the ability of the anti-epileptic medication to stop all of her seizures.